So now in our current classifications, neurocognitive disorders is basically a category of mental health disorders primarily affecting cognition, and they are classified into three main chapters. One is delirium, two is the mild neurocognitive disorders, also known as MCI or mild cognitive impairment, and then the major neurocognitive disorders, what we used to call dementia. The DSM-5 defines 6 key domains of cognitive function that we use to describe these disorders, including executive function, learning and memory, perceptual motor function, language, complex attention, and social cognition. So let's first start with delirium. Delirium is definitely a medical emergency characterized by sudden and severe disturbance in the person's mental abilities. It's basically an acute confusional state that develops quite rapidly over hours or even days, caused by an underlying medical condition in most cases, such as an infection, a dehydration, or a drug toxicity. Advanced age, hospitalization, and chronic medical illness are major predisposing factors. So older adults are at definitely much higher risk than younger populations to develop such a condition. It is characterized by disorientation, inattention, hallucinations, and change in their sleep pattern are common. So they may have a reverse sleep rhythm where they are more agitated at night and more sleepy during the day. Based on their motor activities, it could be classified as hypoactive or hyperactive delirium. And in general, treatment is always targeted towards addressing the underlying cause. So let's move on to the mild neurocognitive disorders, also known as MCI or mild cognitive impairment. So what is mild cognitive impairment or mild neurocognitive disorders? It's basically a condition that involves a decline in cognitive function that is still greater for what we expect for somebody's age and educational level. And if we want to quantify it, we typically look at a deviation that is more than 1.5 standard deviation below the normative expectations. And it's not severe enough to interfere with daily activities, and that's a key criterion. Individuals can usually compensate for these difficulties with the help of some strategies and support from others, so they may require some reminders. They might write things down using lists, using technology to cover up for their mild deficits. And a key component here again that it should not interfere with their daily activities. So who is more likely to develop such a disorder? We're talking about aging, hypertension, diabetes, patients with heart disease, and mental disorders like depression or anxiety. They are usually classified either into amnestic versus non-amnestic based on cognitive deficit focused more on memory problems, or they can be classified as progressive, non-progressive versus reversible. So reversible if there is an underlying reversible cause, which we will come to later on, or a progressive, which is usually a degenerative disease, versus a non-progressive, which could be caused by a head trauma, anoxia, or vascular insult. So when it comes to amnestic mild neurocognitive disorders, it could be actually an early sign of Alzheimer's disease. So the patient might experience such a symptom and then things progress into full-blown Alzheimer's. Some may experience stable or even improved function over time, depends on the underlying etiology. If it was reversible or vascular, things may stay stable. Management usually includes just monitoring them and non-pharmacological treatment. However, that may change in the future as we discover more therapeutics targeting at disease modifying. We may think about intervening at this stage before it converts into Alzheimer's. So how common is the mild neurocognitive disorder? So the epidemiology is usually understudied because it doesn't even interfere with their day-to-day activities. It's hard for them to come forward and see a clinician and say, hey, I'm having a problem. But a meta-analysis in 2022 showed that for those who are 50 years or older, worldwide, the overall prevalence is somewhere around 15%. The prevalence rate of amnestic MCI is around maybe 10%, and the non-amnestic MCI is less prevalent. The prevalence is usually affected by age, gender, education level, and region of the study site. Let's talk about major neurocognitive disorder, which is the bulk of our talk today. So major neurocognitive disorders, how do we define them? As opposed to how we just defined mild neurocognitive disorders, major ones are usually a serious decline in the cognitive function that affects the person's ability to perform daily activities. And on normative scores, we expect a deviation for more than 2 standard deviations from the normative values. The symptoms are usually gradual, progressive, leading to significant disability and somewhat loss of independence. There are so many types of major neurocognitive disorders, but Alzheimer's is the most common type. Diagnosis is usually based on a comprehensive medical, neuropsychological evaluation, and brain imaging to look for biomarkers. So back to the DSM-5 criteria, when it comes to major neurocognitive disorders, it requires a significant cognitive decline in at least one cognitive domain as determined by the clinical evaluation and standardized testing. It's preferably to have both. It should be severe enough to interfere with independence in daily activities. It should not occur in the context of delirium, and it should not be better explained by a mental disorder or the effects of a medication or a substance. And there should be an evidence of a cause that we can think of, like a medical condition, Alzheimer's disease, Parkinson's disease, Huntington's dementia, frontotemporal dementia, vascular dementia, TBI or HIV infection, among many other causes. Okay, so let's sit back and take a moment and think, why are we discussing all of this? How expensive this disease can be and what's the burden of it worldwide? Why is it so important to learn about these conditions? That takes us to the epidemiology of major neurocognitive disorders. So the epidemiology of dementia is pretty important because in 2021, we recorded 55 million cases worldwide, and that number is expected to triple in just 30 years, with 2/3 of cases will be in low to middle income countries. We also estimate that 10 million new cases per year will be diagnosed, and the prevalence does increase according to the age group, so it ranges from 3% of those who are between 65 and 74 up to 1/3 of the individuals aged 85 or above. It was found to be slightly higher in women versus men, and the median time from diagnosis to death also depends on the age at diagnosis. So you're talking about 6.7 years of people diagnosed below 70, and only 2 years for people diagnosed at 90 or older. And that is important to estimate how many years of lost functioning we're talking about, especially when we're having an aging population worldwide. So what about the United States? So the Alzheimer's Association stated that we have around 6 million Americans who have Alzheimer's disease in the United States. Most of them are women, and it's projected to also triple to up to 14 million cases by 2050, in 30 years from now. And the prevalence is very similar to how it is worldwide, where we see around 5% among those aged between 65 and 74, up to 1/3 of those who are aged 85 and above. African Americans and Hispanics are at higher risk than whites, and they are less likely to receive a timely diagnosis. The CDC puts Alzheimer's disease as the 7th leading cause of death among all age groups and the 6th leading cause of death in older adults, meaning 65 and above.